Good afternoon. My name is Edward Bryant, and I would like to share with you some information about diabetes. As American citizens, we have the distinct privilege of living our lives the way we see fit. And included in that privilege is the right to eat what we want, when we want it. However, this is not the case when it comes to people who have and or deal with the challenges of diabetes on a daily basis. According to the American Diabetes Association, this incredibly severe disease is the 7th leading cause of death in the United States today. This forces us to change our perspectives on how we take care of ourselves. Diabetes has a significant impact on how we live our lives because it causes a tremendous amount of health risk. It requires a strict diet, and it can hinder certain job opportunities for many of us. Diabetes affects the blood sugar levels in the body, causing an over or underproduction of insulin needed to sustain a higher quality of life and health. This condition is also a disease of the blood vessels. It increases risk of heart disease, strokes, heart attacks, nerve damage, vision loss, kidney failure, amputations, and a lengthy list of other severe complications. This is why it is so important to manage with not only the proper medications, but the proper diet. Having a strict diet in itself is a challenge for most people in this country, but a well-worth one. Diabetes is controlled by the amount of carbohydrates that we consume, which causes a burden for newly diagnosed diabetics who haven't mastered the juggling of good and or bad food and how much they should or should not eat. Ice cream, white bread, and rice are all examples of foods that increase your blood sugars to unhealthy levels if you do not eat them with extreme care. Most doctors can refer you to institutions that are available to teach people with diabetes how to eat properly to better control the disease. And while health risks and the ability to manage a strict diet are all important things to know, some things pertaining to diabetes can cause unexpected problems, like limited job opportunities. Because diabetics routinely have to take medications that drop their blood sugar levels, possibly causing a coma or even death, most states take extreme precautions when considering the requirements for a diabetic to drive any vehicle for commercial use, such as semi-trucks or buses. For example, the state of Michigan requires a waiver for a diabetic to be able to obtain or maintain licensing for commercial transportation services. Diabetes can and will get in the way of your progress, but only if when you apply for these type of jobs, your blood sugar levels are not maintained. Managing diabetes is possible with discipline and courage to pursue the best life for yourself and the best possible way. Now, after today, I hope that if you find yourself somewhere down the line having to routinely give yourself shots or consistently keep track of your blood sugar levels, that you will be a little more confident, a little more prepared, and a little more determined to deal with whatever health risks, whatever strict diets required, and whatever limited career opportunities or threats that you may face due to this challenging but manageable disease. Thank you.